Next, we're going to be looking at different types of skin cancer. And cancer as a disease is abundant in types. So, cancer is just not one type of disorder, so we are narrowing our look for review to just skin cancer. The three types we're going to look at are basal cell carcinoma, squamous cell carcinoma, and melanoma. The most malignant or most essentially cancerous and more often to metastasize type of cancer is melanoma. Melanoma is very malignant. It's the most dangerous type of skin cancer. That's because it grows quickly, it can move to other parts of the body and cause tumors to grow there, and some are even resistant to chemotherapy. Melanoma is cancer of the melanocytes. And what we have to do to treat it is treat it by wide surgical excision, so remove both the infected area that is growing out of control, and we want to accompany that with removal of skin surrounding it. And still, usually immunotherapy or some type of chemotherapy is recommended. Chance of survival is actually already poor if the lesion is over 4 millimeters in size. And that's not just width, that's also thickness, so deep into the skin. Now, squamous cell carcinoma does also grow rapidly and it can metastasize if not removed. And this is cancer of stratum spinosum keratinocytes. But as long as you treat it quickly, the prognosis is pretty good for squamous cell carcinoma. You want surgical removal and sometimes also radiation therapy. Then there is basal cell carcinoma, which is the least malignant and most common type of skin cancer. And it is going to be cancer of the stratum basal cells. And generally, it can be cured in most cases, so 99% of cases, by just surgical removal. So when we're talking about skin cancer, we want to just be aware of what's going on our skin. It is recommended that you keep track of freckles and moles and any new thing that pops up on your skin because you want to be aware of if it's changed. You want to be looking for if the asymmetry has changed, if one half of the mole looks different than the other, if the border is now irregular, if it's starting to be notched or blurred or jagged or ragged, where it used to be kind of round or oval. If the color has changed, especially if only one side has changed. So if it includes multiple shades now where it used to not. If it's starting to grow, so if the diameter is increasing, that's definitely something to be aware of. And a new one that's been added to what used to be called the ABCD rule for skin cancer is E, which is evolving. So if there's anything a little different about a mole or a freckle, if it's changing in size, shape, color, or you suddenly have a new speck that's right next to it, those are all things that you just want to be aware of. We can see some examples of asymmetry and border irregularity and color changes and some growth compared to previous growth over on the right. Some examples of melanoma and squamous cell and basal cell carcinoma are up at the top. But we can also see the example of evolution, where it's not a real abundant or noticeable change if you hadn't been taking notice. It's something easy to miss. So I definitely recommend that if cancer or skin cancer especially runs in your family, that you go to a dermatologist and just have them take a look. Have them check behind your ears, behind your kneecaps, on your back, on your scalp, areas that you can't see. Your dermatologist might take a picture so they can better monitor your moles and keep you safe from skin cancer, or at least treat it early. Going at least once a year is great, but if you do ever have a skin cancer, maybe going more might work out better for you. Every 6 months tends to be good, but 6 months to a year would be great for making sure that you're not developing a type of skin cancer, and that at least if you are, we catch it early. So one of the last things we're going to talk about are 3 types of burns. So we have first degree, second degree, and third degree. Both first degree and second degree have similar symptoms. They include localized redness, swelling, and pain, but only second degree burns actually also come with blisters. So again, only second degree burns have blisters. Otherwise, the symptoms between first degree and second degree are very similar. You may have a little bit more pain with second degree, but still similar symptoms. With a first degree burn, it's called a superficial burn because only the epidermis is damaged. With a second degree burn, both the epidermis and at least the upper regions of the dermis are damaged, So it's called a partial thickness burn. With a third-degree burn, the entire thickness of the skin is damaged, the epidermis and the entire dermis, sometimes maybe even going into that subcutaneous tissue. So this is a full thickness burn. It's also the most dangerous. And the burned area can appear kind of gray, white, or cherry red or black. So there's some differences in how it may appear. But there's actually no initial swelling, no initial pain, because this is such a severe burn that the nerve endings are destroyed. So what this might look like is some just redness, maybe because you touched the stove real quick, or redness with blisters because you're out in the sun too long, or charred skin or cherry red skin, usually with no blisters because there was nothing to blister because the skin was destroyed. So what I was describing there in sequence was a first degree, then second degree, and then third degree burn. The way that you would treat burns is debridement. So remove the burned skin first. Then do antibiotics, maybe give a temporary covering. With severe burns, you might need a skin graft. Some temporary coverings help promote healing, like metally grown tilapia. Their skins are sometimes used as temporary coverings. But still, the biggest concern with burns is first and foremost dehydration and fluid loss, because that can lead to protein and electrolyte imbalance. It can cause renal shutdown, circulatory shock. So protein and fluid loss that can cause dehydration. That is our biggest concern. The secondary concern, of course, is infection, because infection can derail healing and even cause death, especially if someone's already experiencing shock from a third-degree burn. So keep that in mind when you think about skin cancer, possible treatment, getting checked out with a dermatologist, but also just keeping an eye on things yourself. And then now you also have more information about burns and general treatment. Please see a medical professional if you have a severe burn. So keep that in mind. Do more research if you feel like you need it. All right, so that's it for our review of Chapter 5. So make sure to watch the 2 parts.